Yeah. So here we go. One of the things that I want to do is to see you all better. Somehow seeing you all makes me talk better. I don't know why that is. All right, so here we go with empty chair work, part two. So the last time we were here, we kind of set this up a little bit. And I wanted to give you today a little bit more of an in-depth exploration or an in-depth explanation of how to do this technique. This was just kind of a cool quote. The greatest hazard of all, losing oneself can occur very quietly in the world as it was nothing at all. No other loss can occur so quietly than any other loss. An arm, a leg, $5, a wife is sure to be noticed. That just for me set up what it must be like to be where our clients are at times. So I have attached to this presentation an article that has the protocol that I'm going to talk about. It's by Eleanor Longden and Company. And it's a very well written article, easy to follow. So I would encourage you, if you want to do this, to read through that article. It's really easy to understand. It's a hard technique, and I know people get kind of weirded out by doing role plays or empty chair work with anybody that's got some kind of psychosis going. I know in the old days, we used to fear that that would split the personality even more so. So we shouldn't do that. As it turns out, being able to talk to the voices rather than avoid them or distract from them or even focus away from them seems to have a very powerful effect on the distress experienced by the client. So here we go. This is based on how we learn to define ourselves. So when we're infants, the only way that we can really define ourselves is through communication with another person, a smile, a laugh, a stern look. So we begin to understand ourselves by having a shared understanding with somebody else. We understand experiences in particular ways based on the other that we're having communication with. And as such, we end up with a sense of self that's defined by us, but also by those people around us. Is that making sense? Like the only way that we can figure out, where the boundaries are, is to really have that communication with those who are raising us. What happens then, and I'm all sure you're well aware of this, is that those voices of the people who have helped to define us become internalized in our head. And that then becomes the internal endless chatter that I know many of us deal with in terms of, self-defeating thoughts and critical thinking and all of that stuff. So we have a lot of different people in our lives. And so we have all kinds of different selves that develop. We have people in our lives that are soothing and caring and supportive, people that are critical, people that are hard to get along with, people that are angry. And we learn each of those styles of communication from the people that we grow up with and hang with all the time. And we call that, the literature calls that a society of the mind, all those different selves. And the whole self is all of us put together, hopefully with the ability to extend a particular self or way of communicating at appropriate times, adapting to the environment as necessary, right? So many folks have a really healthy dialogical mind. That's what we call that, a dialogical or relational dialogical. So many of us have very healthy voices inside. We can do it, you're fine, doing the best you can is great. But then there's a lot of us that have that critical critical self. Of course, a lot of us have that humorous self. There's the child self, maybe the adult self or the parent self, right? And if those parts go too far, then it becomes more pathological. And I don't like that word because I'm used to looking at things from a developmental point of view rather than pathological. But that would be the less healthy side of our society of mind. And the empty chair work gives us an opportunity to take that voice inside of us included, right? To put that into a chair and begin to manage it on a kind of on a one-to-one basis. So does that all make sense so far? I know it's kind of abstract. It's all making sense. So I'm going to go, okay, good. You're all getting this. So if you remember that dopamine theory, and you probably remember this graphic somewhere, we've put this up. When we get those rushes of dopamine, everything is important, and we don't know how to distinguish what the main thing is that I have to pay attention to. Everything is important. So the brain will confabulate or make up stories about how things are connected, right? And there's usually an I or a me within that connectedness, right? So I'm important, the desk is important, the computer is important, right? But there's an I in there. I run, I walk. But with schizophrenia and psychosis, that I gets completely lost. There is no I. It's not I ran down the street, it's ran down the street. There is no self-definition that comes about as easily as it does for you and I. So there's a lack of connection between the subjective experience of one's self and body experience, because everything is the same amount of importance. Is that making sense? We get lost in there. So when somebody comes into our office with a diagnosis of schizophrenia or psychosis, it's helpful to keep in mind that that sense of self is diminished. And this is why it's so important to help the person have a sense of agency while they're with you. Harry had mentioned an article, and I did not I did include it on my copy, but it's not on this copy. An article that talks about agency before action. And Harry, maybe you can put in the chat the reference to that, if you would. And that means that the person really has to have some sense of power in order to be in a relationship with you. There has to be some sort of I. So giving them as much power as you can in the office is one of the most important things you can possibly do. Where to sit, how this is going, where do you want me to slow up? All of those things are important. The more choices that we give, the more that client is able to define themselves. Of course, it's also helpful as we need to highlight that. Okay, I see that you prefer sitting this far away, or I can see that you're, getting tense, your hands are clenching, and highlighting that and helping the client to define what they're doing and connecting that to their body experience helps them to define who they are. So we work with that inner dialogue that they bring with them, and we collaborate with the client to take the voice, put it in a chair, and work to understand what that voice is trying to do. Those voices are representing parts of self that the voice hearer has rejected in some way. They want to avoid that, push it out. So that might be the angry part of them, for example, when they hear those terrible, horrible, critical voices. And we can hear that as therapists when they're sharing that information. So just as our own negative thoughts can push us to discover that we're distressed and need help or need to go find a counselor, those voices have a purpose in creating distress in much that same way, right? It draws attention to things that are unresolved. So the client suppresses, much as everybody else does. And I bet you remember the whole thing on suppression as opposed to reappraisal, right? So when we suppress, that takes a lot of energy and a lot of cognitive capacity. Whereas if we're able to accept it and look at things face forward, we have an easier opportunity to reframe things. So this is what we're doing. We're giving them an opportunity to reframe things in a very different way. So rather than being a therapist who is attempting to influence the client to see things in a different way, which we all know is very difficult to do with somebody that has very rigid delusions and very strong hallucinations, it does sometimes become a tug of war. I know I have felt that. I would imagine that some of you have felt that when you're in session with clients as well. How am I going to get this person to understand what's happening here? And we, go through all kinds of creative activities to help our client do that. It's still kind of a tug of war. But when we put ourselves with the client and collaborate with them to develop better relationships with the voices that they hear, then we become part of the process with the client. So it's not just the client doing it for him or herself, it's you and the client doing it for the client, right? And that becomes a sense of relief for the client. In some of the articles that I've read about this, the participants actually said, when I realized that I wasn't alone doing this anymore, that it wasn't just me, I had an incredible sense of relief, right? The purpose in the first instance is to change the client's mind. In the second instance is to objectively explore what's going on and help the clients make some decisions, perhaps some dynamic decisions that will change the course of how they view themselves. Talking with voices is an intervention that was developed. Eleanor Longden, as you can see, I've cited her 3 times, has done a lot of work with this particular intervention. And what we're talking about here is that dissociative sense, that dissociative framework can be applied to working with voices. So the article that I've attached along with this describes phases of going through this activity. So the first is engagement and psychoeducation. We want to let the client know what the purpose is of the work. We want to assess which voices are the strongest, which are most vulnerable, which are the ones perhaps that are most soothing. And so that assessment and formulation of voices is very important. Up to 7 sessions are taken with just exploring that alone. Then the dialogical work begins, and that includes having the client and you decide who you want to put in that chair, which voice you want to put in that chair, and how you want to work with it. Okay, so it's not unlike, I guess in my head, I was thinking that this is not unlike couples therapy, where you're trying to facilitate a better relationship. The explanation of all of those phases are described beautifully in that article. Okay, so the goals of this are to reduce the distress by really changing that relationship between the client and the voice. You want to consider the implications of doing this, like if we attack the most critical voice first, for example, what are the implications of that? How is the client going to still follow through perhaps with what the voices say? That's an issue that we would be thinking about. Look at the themes, as always, as we go through the session, as we go through the work. Look at themes that pop up for this client. Maybe it's self-defeating attitudes, maybe it's dysfunctional family issues, maybe it's abuse or post-traumatic stress, whatever that might be. As you continue to work with the client, you'll get to a place where there is some kind of understanding about what those voices are about for that client. At which point we would evaluate how this is going and sum it up for the client. And I would do this at the end of each session with regard to what we were talking about during that session. And then towards the end of that particular activity, which is going to be quite a few sessions, right, to sum up kind of the whole thing for them, or the two of you would do that. So voice hearers are encouraged by the therapist to have a conversation. The voice is represented by an empty chair, and that chair can be arranged in terms of distance, or, you know, maybe you want to put it outside the room with the door open, or at some point in time, maybe the client will put the chair outside the room and close the door if they want to imaginally put that voice outside in some way. So it becomes a trialogue between you, the client, and the voice, and you're guiding the client. The client is asked to reflect and consider how they want this relationship to be different. What would be helpful from the voice? What do they want the voice to do differently? How can they talk perhaps more kindly to the voice so that their own sense of self has a sense of calmness and control about it? Even the therapist can play the voice, guys. And I know that sounds kind of scary, but you can. And I have done that in session. And of course, I say, I'm playing this voice right now. And then I say afterwards, I'm not that voice right now. Right. And the client can play the place of the voice as well. So the main thrust here is to decrease the distress and the intrusiveness of these voices, the nastiness of them. Some of the questions that you might ask to the voice: how do you feel? You know, when did you decide to come around? What do you think would happen if you weren't here? That's, I think, a really important question. I think that a lot of the answers we would find, and a lot of the answers that I hear in people without psychosis, is that critical mind. If I weren't here, you would get in some deep, deep trouble, is what I often hear from clients just doing an empty chair work. And I would imagine, I'm imagining the voices do much the same. If you use, I had a client who said, if you use, I will kill your parents. Well, that's horrible, right? On the other hand, the guy stayed sober. So we discovered that the voices actually were in some terribly inelegant way trying to help this poor guy. And so what we do there is to help the voices and the client develop a better relationship. I'm going to listen to you, but only if we're agreeing on what's healthy and appropriate, right? Things like, do you know the other voices? Who are they? When did they come along? What do you need from the client, right? What do you need from me? Okay. So these are examples of questions that you can ask the client, you can ask the voice, and as the voice, you could ask the client, perhaps. All kinds of ways we can do this at this point. Overall, it's about having a better relationship with the voices. We all know that medication doesn't always take the voices away. They're still there in some way. So this kind of management of the voices can be extremely helpful in reducing the distress. The research on it really shows some promise. One of the warnings is, don't start with the worst voice. Start with a voice that's medium, or intermediate. And I wouldn't start with the most vulnerable one either. As I was writing this, Harry was asking, I wouldn't, what do we start with, the most vulnerable one? Probably not that one either. If there's only one voice, then we only have one choice, right? But if you've got some choices, try to hit an intermediate distress level voice and begin to work there. Collaborate to do whatever experiments you're going to do. Practice role plays. I would arrange with the client to have a prearranged signal to stop if things get overwhelming, and have a direct conversation. So obviously preparing the client is really essential. Having all kinds of self-soothing skills on board is really important. Set an allotted session to do this. Develop a self-soothing kit are all great ideas. Make sure this person has some trusted people. Teach mindfulness, and also helping the client to come up with short phrases or replies that they can give to the voice when they feel like they need to truncate that, for instance, where they're in public or with other people. How can they respond to the voices in a way that'll quiet them in an important time? Eleanor Longden talks a lot about evaluation and consolidation of the learning. And there is the Hearing Voices Network that has more information about this. You also want to look at that website before, we always say this, before you take your client in there, because some of it can be anti-medication, which is not always that bad, but we just want to be choiceful about how we introduce our clients to that website. And basically summarizing is, what goals have we achieved? How have those relationships changed? We want them to be beginning to use respectful language. We want them to not obey commands, and we want them to know how to self-soothe in light of what they're hearing. So that takes us to the end. And I know that that's kind of an odd intervention for psychosis. It's similar to avatar work, if you've ever heard of that, which is very cool. And the outcomes of that are very robust. I think I talked about that in the first empty chair work talk. So there we have it. And I'm open to any questions that you